Hey everyone, I am Nurse Hannah, and for today we will be doing oxygen therapy. Let us now define first the oxygen therapy. Oxygen therapy is widely used in the management of number of chronic and acute health conditions. The therapy may be used in the hospital setting or pre-hospital setting, in the ambulance to manage emergency situations, or in the home setting to manage long-term health conditions. The mode of delivery and device used for oxygen therapy depends upon several factors including the patient's specific needs and the opinion of the medical professionals. Okay, so good day, ma'am. I am your nurse for today. I am Hannah Micaela Itaya, your assigned nurse. And may I know your name, ma'am?
Clear.
Your birthday?
February 29th.
Okay, good. So for our assessment, we will first determine time history, including acute and chronic health problems. Since you do not have a acute and chronic health problems, we will now start to check for your respiratory pattern, rate, depth, and rhythm. This will help us to determine for your need of oxygen as well as your response to the therapy. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Okay, based on your respiratory sign after our assessment, your respiratory pattern is apnea or normal. Your rate is 30 breaths per minute and the depth is deep. And for your rhythm, it is normal. Okay. For your third assessment, we will check for the extremities and mucous membrane. This is to ensure that you are in need of oxygen administration or therapy. Okay, based on your mucous membranes, it is ink and noise. Next assessment, we will check for your pulse oximetry result using pulse oximeter. This is one of the important determinants for your effectiveness of your pulmonary system. Also, this is to support your need to perform the procedure or the oxygen therapy. So for your result, you have a oxygen saturation of 90 and a beats per minute of 77. It means that we need to administer oxygen via nasal cannula. Okay, ma'am. So for our next assessment, we will note for your lung sound, we will note for wheezes or fracas because secretions may interfere to the air oxygen or airway patency and the diffusion of oxygen and carbon dioxide across the alveoli capillary.
Okay na Go.
Okay, for our next assessment, we will note for your lung sound. We will check for wheezes or crackles because secretions will interfere with airway patency and diffusion of oxygen and carbon dioxide across alveolar capillary membranes. Let us now check for your lung sound. You will need to inhale and exhale again. Inhale. Exhale. 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 So I will now check for your nostrils, the back of your earlobes, and your cheek. This is to ensure that it is safe to administer oxygen. So for our planning, ma'am, we will verify the physician's order and for you, ma'am, we do have a order of nasal cannula with 2 to 6 liters of oxygen per minute. This is to ensure the need to perform the procedure. Also, we will check your room. It needs to have a no smoking sign. This is to make sure that it is safe to administer oxygen. So for our next step, we will prepare for our things we need or for our equipment. We do have here the pair of sterile gloves, the nasal cannula, the bandage scissors, and of course our micropore tape. Okay, ma'am, before we start, I will explain to you the procedures. This will help to relieve your anxiety and to gain cooperation from you. We will do a oxygen therapy or administering oxygen via nasal cannula. Nasal cannula will help you to increase your oxygen saturation since earlier you have a oxygen saturation of 90. Normal values are within 95 to 100% of 299 oxygen saturation. It delivers low concentration of oxygen and it is administered 2 to 6 liters per minute. For our next step, we will attach the flow meter since we do not have a physical flow meter. I just printed out for us to visualize. This is the flow meter, and this is to regulate the flow rate according to the attach at the base of the flow meter, which is this, the base, and the humidifier at the base of the flow meter, and we will fill it with water up here. This is the maximum. We can put it for 100 ml. This is because oxygen forced through a water reservoir or humidified before delivering to a patient because this will prevent dehydration of the mucous membranes. So, for our next step, we will be attaching the tubing to the oxygen device. This is to secure the oxygen flow, or rather to have an access to the oxygen resource or source. Okay, so ma'am, after attaching the end of the tubing, we will now set the appropriate flow rate for the oxygen device that we will need. Since we will be administering nasal cannula, we will need 2 to 6 liters per minute. This will facilitate effective delivery of oxygen to the prescribed oxygen device. Okay, after setting the appropriate flow rate, we will now check for the oxygen from the tube. Now check for the oxygen if it is moving freely. There should be no kinks and the connection should be alright. This is to ensure that there is no oxygen that we will escape. Okay, ma'am, before we start or before we put that in your face, we will now check for the humidifier if there is bubbles. Since there is none, we can now continue to checking the oxygen if it is flowing freely here. This is to ensure that the equipments are working. Okay, so this is the nasal prong, and we will put that to the nostrils of the patient. Let us now start. Touch it to the ears of the patient, and we can adjust it using the slit ring. And we can put tape to stay, to let the nasal cannula stay in place. So it keeps the delivery of oxygen in place, and also to ensure that you are receiving the amount of oxygen that you need. Ma'am, I will just ask you something. Do you have dryness or irritations after administering the oxygen by nasal cannula? Okay, great. Because dry mucous membranes are more prone to break down because of friction or pressure from the nasal cannula. Okay, ma'am, we need to regularly check the water level of the humidifier since it is still in the right amount of water. I will check it later. This ensures that this ensures continuous humidification and prevent dryness of the mucous membranes. Ma'am, I am back to remove your oxygen device or nasal cannula because it will help you to not be dependent on the oxygen device. We need to dispose this properly for us to avoid the risk of contamination from the microorganisms from the patient and from the environment. Ma'am, for our evaluation, we will check for your vital signs, level of anxiety, color, and risk of respiration. For your vital sign, your BP is normal, 120/80, respiratory rate of 20, heart rate of 77 beats per minute, and your oxygen saturation is now on 92%. This is to detect and address any outward responses from the therapy. So, as we have checked earlier, you do not have any signs of hypoxia, tachycardia, confusion, and dyspnea. Okay, for our next evaluation, we will monitor for your oxygen saturation, including your ABG after 20 minutes of administering the therapy as ordered by the physician. This will evaluate the effectiveness of the therapy since I've said a while ago that your oxygen saturation already increased up to 2%. We can continue the administering later. Okay, for our last part, ma'am, I will record the procedure and your response to the therapy. Also, for us to have a recorded data for your continuity of care. Okay, ma'am?